Imagine waking up tomorrow with a fever. You'd grab a thermometer, maybe some paracetamol, and if it got bad, you'd be in a clinic within the hour. Total time invested? Maybe an afternoon. Total risk? Almost none. But for over 99% of human history, getting sick wasn't an inconvenience. It was a roll of the dice that could end your life within days. So what did people actually do when there was no doctor, no pharmacy, no antibiotics, and no idea what a virus even was? The answer is stranger, darker, and far more resourceful than you'd expect. And it starts in a cave in modern-day Iraq.
In 1957, archaeologists excavating Shanidar Cave found the remains of a Neanderthal buried roughly 60,000 years ago, surrounded by pollen from yarrow, cornflower, and other plants known today to have medicinal properties. Some researchers argued this proved Neanderthals understood herbal medicine. Others pushed back, suggesting the pollen blew in by accident. But newer evidence settled the debate in a different cave entirely. At a Neanderthal site in Spain, scientists analyzed hardened dental plaque and found something remarkable: traces of poplar bark, which contains salicylic acid, the same compound found in modern aspirin. They also found a natural penicillin-producing mold in that same plaque. This wasn't an accident. This was self-medication, deep in the genetic past of our species, long before anyone had a word for medicine at all.
For early humans, plants were the only pharmacy that existed, and they figured out, through generations of trial and brutal error, which ones helped and which ones killed you. Willow bark for pain and fever, garlic and onion for wound infections, certain mosses, which we now know have antibacterial properties, packed directly into open cuts. None of this was guesswork passed down once. It was tested, refined, and tested again, across thousands of years, by people who had absolutely nothing to lose by trying. But plants could only do so much. When the problem wasn't a fever, but something physical and catastrophic, like a skull fracture or violent head trauma, ancient humans developed something that should not have worked. And yet it did. Trepanation. The deliberate act of drilling or scraping a hole into a living human's skull. Archaeologists have uncovered trepan skulls from Peru to France to Russia, some dating back over 7,000 years. And here's the detail that stops most people cold. Many of these skulls show clear signs of bone regrowth around the hole. That means the patient survived the surgery. Not for a few days, for years afterward. Think about what that actually required. No anesthesia beyond whatever plants could numb the pain. No sterilization beyond fire and whatever passed for cleanliness. No understanding of brain function, infection, or blood loss. And yet, in some regions, survival rates for trepanation reached as high as 50 to 70%. Ancient surgeons, operating purely on observed results, eventually learned which methods caused less bleeding, which tools caused less trauma, and which patients could tolerate the procedure at all. This wasn't mysticism. This was applied trial and error on the most delicate organ in the human body, performed by people with stone tools and zero formal training. Scales weren't the only part of the body ancient healers were willing to operate on. Teeth turned out to be one of the most relentless sources of suffering in the ancient world, and the evidence for how people dealt with it is almost unbelievable. In Pakistan, archaeologists discovered 9,000-year-old molars with neat, precise holes drilled straight into the enamel, reaching the inner pulp where the nerve lives. This wasn't decoration. This was ancient dentistry, performed with tiny flint drills, almost certainly without anything resembling pain relief. In Italy, researchers found a 14,000-year-old tooth that had been scraped clean of infected material and packed with a primitive filling made of bitumen and plant fibers, a filling that held in place for thousands of years afterward. Toothaches in the ancient world weren't a quick visit to a dentist. They were a source of agony that could last for years, sometimes spreading into infections that became fatal. And the people who suffered through them clearly tried everything they could think of, rather than simply enduring it in silence.
Now here's where it gets even stranger. Long before anyone knew what bacteria were, ancient cultures across the world were independently fighting infection with substances we now know are genuinely antimicrobial. Ancient Egyptian medical texts, some over 3,500 years old, describe packing wounds with honey. Modern science has confirmed honey creates an environment hostile to bacteria due to its low moisture content and natural hydrogen peroxide production. Mesopotamian healers used moldy bread directly on infected wounds, the same mold family that would eventually give us penicillin, discovered by accident thousands of years before Alexander Fleming was ever born. They didn't know why it worked, they just noticed again and again that wounds treated this way healed, and wounds left alone often didn't. This pattern shows up everywhere once you start looking for it. Communities developed remedies independently on different continents with zero contact with each other and arrived at startlingly similar conclusions. That's not coincidence. That's the same brutal filter at work everywhere humans existed. Try something. If it works, the patient lives, and you remember it. If it doesn't, you bury someone, and you remember that too. Knowledge accumulated not through experiments in a lab, but through the unbearable cost of failure, repeated for thousands of generations.
But medicine in the ancient world wasn't purely physical. Long before anyone separated the body from the mind, illness was treated as something that affected both at once, and the cure often involved ritual as much as remedy. Archaeological and anthropological evidence from cultures across the globe shows healers combining herbal treatment with chanting, drumming, smoke, and ceremony, not as a substitute for practical medicine, but alongside it. In many cases, this had a genuine effect. Modern researchers studying the placebo response have confirmed that belief, ritual, and the presence of a trusted healer can measurably reduce pain perception and stress hormones, which in turn allows the body's own immune response to function more effectively. The shaman chanting over a sick patient wasn't simply superstition standing in for science. In many documented cases, it was an early, intuitive form of psychosomatic treatment, layered directly on top of whatever herbal or physical remedy was also being applied. Long before germ theory existed, some ancient societies had already figured out, purely through observation, that sickness could pass from person to person, and that distance was the only defense. Historical records from the Old Testament describe isolating people with skin diseases outside the main camp until symptoms cleared, a practice that mirrors modern quarantine almost exactly. During the bubonic plague centuries later, port cities in the Mediterranean began forcing incoming ships to wait offshore for 40 days before anyone could come ashore, the origin of the very word quarantine.
But who actually held this knowledge? In most ancient societies, it wasn't one person with a medical degree. It was the healer, the shaman, the village elder who had spent decades watching what helped and what didn't. This knowledge was rarely written down. It was memorized, tested on real people, and passed from teacher to apprentice, sometimes across 40 or 50 years of practice. A single skilled healer might carry the equivalent of an entire hospital's worth of accumulated knowledge inside their head, knowledge that could vanish completely if they died before passing it on. That fragility is part of why so much ancient medical knowledge has simply been lost. It never made it into writing. It only existed in memory. And for every documented success, there was an enormous and largely invisible cost. Before vaccines, a single outbreak of smallpox or plague could kill a third of a population in months. Before any understanding of germ theory, women died in childbirth at rates that are almost unthinkable today, often from infections that a single course of modern antibiotics would resolve in a week. Life expectancy across most of human history hovered somewhere between 30 and 40 years, not because people couldn't survive past that age, but because childhood disease, infection, and complications during birth killed so many people before they ever reached old age. The ancient world wasn't gentler than ours. It was simply unprotected.
And this is where natural selection becomes its own brutal form of medicine. Populations exposed to repeated waves of disease over thousands of years developed genetic resistances their ancestors never had. Certain immune adaptations seen in modern humans trace directly back to ancient epidemics that wiped out the people who lacked them. In a very real sense, every person alive today is descended from someone who survived something that should have killed them. An infection, a fever, a wound that should have turned fatal, and didn't. Not because they were treated correctly by modern standards, but because something about their body or their healer's instincts happened to be just enough. So when historians piece together how ancient humans dealt with illness, the picture that emerges isn't ignorance, it's relentless, desperate experimentation, conducted by people with no microscopes, no germ theory, and no second chances, who still managed to stumble onto antiseptics, painkillers, dentistry, quarantine, and survivable brain surgery, centuries or even millennia before science could explain why any of it worked. Go back to that imaginary fever from the start of this video. The thermometer, the tablet, the doctor's appointment, none of that exists without the thousands of years of trial, error, and loss that came before it. Every modern medicine you've ever taken is built on a foundation of ancient guesswork that occasionally, against incredible odds, got it right. You didn't inherit modern medicine by accident. You inherited it from people who buried far more patients than they saved, and kept trying anyway. If this changed how you think about that next trip to the pharmacy, let me know in the comments which ancient remedy surprised you the most, and subscribe if you want more stories like this, because the history of survival is far stranger than anything we were taught in school.